You probably already know that that big fat butterfly probe full of microchip transducers that lets you do whole body imaging with a single device also presents some problems when we want to send that whole sound beam through a narrow intercostal space. Here are a few tricks that I've found helps me get better cardiac images with my butterfly. First of all, keep in mind that the heart moves within the chest. It's only attached at the great vessels. So sometimes just rolling the patient will bring the heart closer to you and help you get better images. The respiratory cycle makes a difference too, as the lungs move the heart slightly inside the chest. In the parasternal views, I seem to get the best pictures when I keep my probe flat, perpendicular to the chest wall. Even a little bit of rocking back and forth sends more of that sound into the ribs. So you need to move the heart into your sound beam, either by having the patient breathe or by rolling the patient. You can see the extra clarity, especially in the near field, just by rolling the patient somewhat onto their left side. Tip number 2 is for the all-important apical four-chamber view. We can't keep the probe perpendicular in this view, so we really need to open up the intercostal spaces as much as possible. So rather than just rolling your patient into the left lateral position, get them into what I call the left stretch position. Get their elbow on the pillow, get their head on their hand, so they're really stretching their torso to the right and opening up the rib spaces to the left. Now, obviously, not every patient you run into is going to have the mobility to get into this position, but trying to get them as close to it as possible is going to help you out. Tip number 3 also applies to the apical four-chamber view, 0. As you insonate the heart and press the probe against the chest, there's a natural tendency for the edge of that probe to slide into the intercostal space. And that might even be the right thing to do for a standard phased array probe. But the big butterfly probe, look what happens. Most of that sound is going right into the rib. So you need to back off and get the edge of that probe riding on the rib so that the sound waves go through the intercostal space. Now, this can be tricky because as you press hard, and you do need to press hard, there's going to be a tendency for the edge of that probe to slip back into the intercostal space. So you have to stabilize it and ride that rib. Look at the huge difference. On the left, the edge of my probe is slid into the intercostal space, and on the right, I'm riding the rib. Tip number 4. To ride that rib, you always want to slide your probe in a superior direction. Why? Well, notice that there's always going to be a little air gap here between your probe and the skin that needs to be filled with ultrasound gel. Imagine this green paper is my blob of gel. If I slide upwards into the space and then I need to adjust and move backwards onto riding that rib, look what happens to my gel. Now there's a gap again and the sound is not being transmitted. So when I know where I want to be, I always start one intercostal space below and then slide my probe superiorly to ride that rib, and it will carry that blob of gel with me to maximize sound conduction.
I start too high and have to go down, watch what happens to the blob of gel that I was using as my window. It comes away. So if instead we have our blob of gel here starting too low and moving forward, then we keep a nice blob of gel to be able to see into our window between the ribs.
remember, a few little details can sometimes make a huge difference in your image quality. So if you don't like what you're seeing, remember to roll your patient onto their left. Don't just settle for left decubitus. Really get them into the stretch position to open up those rib spaces. Make sure that you ride that rib and slide upwards with your probe, never downwards, to keep an adequate supply of gel. And then, of course, remember all those other things you learned about cardiac echo. Use enough gel, use enough probe pressure, have the patient control their breathing and have them hold their breath at the right point in the respiratory cycle. By paying attention to these details and getting lots of practice, pretty soon you'll be doing cardiac echo with a butterfly like a real boss.